October is special for various reasons. This October, there's Dashera, Diwali, Halloween. But do you know, friends, that October is also Breast Cancer Awareness Month? We are aware that breast cancer is the commonest cancer that affects human beings globally as per a World Health Organization report in 2018. 15 to 20% of these breast cancer are due to some genetic susceptibility, and so we see clustering of family members affected with these cancers. While it's interesting to note that 5 to 10% of these breast cancers are due to well-delineated genes. These 5 to 10%, which are caused due to definite genetic factors, are called as HBOC or hereditary breast and ovarian cancer syndromes, also called as cancer predisposition syndromes. So why should we be diagnosing these genetic predisposition syndromes in time? Firstly, the treatment protocols, the treatment responses could be different in these genetic predisposition syndromes. Secondly, of course, if it is due to a genetic factor, your first degree relatives need to be checked. They could be at risk and they may also benefit from additional surveillance and monitoring. Last but not the least, sometimes these cancer predisposition syndromes also mandate that the woman who has the genetic breast cancer undergoes certain specific surgeries or takes certain medicines to reduce the risk of further cancers. So while the commonest genes that are associated with these cancer predisposition syndrome, especially for breast cancer, are BRCA1 and BRCA2, it's important to note that they are not alone. There are many other genes like BRIP1, the CHD family, TP53. So if there is a suspicion of a genetic cancer and if the BRCA1, BRCA2 is negative, it does not completely rule out the possibility of a cancer predisposition syndrome. So let's learn in today's session what are these red flags, what are these indicators that point towards a higher risk of a genetic breast cancer or what we call as a cancer predisposition syndrome. Firstly, if there is any lady who has a breast cancer prior to menopause or below 45 years of age, that is a red flag. Onset of breast cancer below 50 years of age but with other first, second degree relatives having a similar history of breast or ovarian cancer, that becomes another red flag. Presence of breast cancer at an age lesser than 60 years of age but what is called as triple receptor negative, that's another indicator. Ovarian cancer at any age is a risk factor for us to consider a genetic cause of a breast and ovarian cancer syndrome. Then there are a few other indicators like any male with a breast cancer, the same person having 2 or more primary cancers, multiple cancers in the same person, multiple family members being affected with breast and ovarian cancer or other associated cancers like sarcomas, brain tumors, endometrial cancers. While this is an outline for us to try and remember the red flags, the important message over here is please talk to your physicians, please talk to your cancer experts, to your genetic experts if you feel that there is a possibility of a genetic cancer in your family. I hope you find this information useful. This October, let's try and disseminate the right information about breast cancer. Thank you so much. If you like this video, you can subscribe to the Purple Gene Clinic.